If you or someone you love is struggling with addiction, medication-assisted treatment, or MAT, may be one of the most powerful tools available for lasting recovery. If you need help right now, call 800-671-4304. Specialists are standing by to help you find a licensed detox program near you. Let's start with an important distinction. Medical detox and medication-assisted treatment are not the same thing. Medical detox is the supervised process of clearing drugs or alcohol from your body. It typically lasts a few days, rarely longer than 2 weeks. Medications may be used during detox to manage acute withdrawal symptoms, sometimes at higher doses and in combination with other drugs. Medication-assisted treatment, on the other hand, begins after detox is complete. MAT uses FDA-approved medications combined with counseling and behavioral therapy to support your recovery over the long term, sometimes for months, sometimes for years. Research consistently shows that people who use MAT have higher sobriety success rates, especially in the early stages of recovery. So who can benefit from MAT? MAT is most commonly used to treat opioid use disorder, including addiction to heroin, oxycodone, and hydrocodone. It's also widely used for alcohol use disorder. Medical detox medications are also used for benzodiazepine dependence, including addiction to Xanax, Ativan, and Klonopin, as well as stimulant dependence, though medication options for stimulants are more limited. Here's how the MAT process works, step by step. It begins with assessment. Your care team evaluates your substance use history and any physical or mental health conditions to build a personalized treatment plan. Next is induction, typically days 1 through 7. Medications are introduced in a controlled inpatient or clinic setting, and you're closely monitored for safety and comfort. Then comes stabilization, which runs through weeks 2 to 4. Your care team fine-tunes dosages, monitors your progress, and behavioral therapy begins. After stabilization comes maintenance, which can last anywhere from 1 month to over a year. This phase supports sustained recovery, reduces relapse risk, and helps restore normal daily functioning. Finally, when the time is right, your care team will guide you through tapering, a gradual, medically supervised reduction in medication. Now let's talk about the medications themselves. Methadone is a full opioid agonist used to reduce withdrawal symptoms and cravings without producing the intense high associated with heroin or fentanyl. Buprenorphine, commonly known as Suboxone, is a partial opioid agonist that activates opioid receptors to a lesser degree, helping to manage cravings and withdrawal without the same risks. Naltrexone or Vivitrol works differently. It blocks the effects of opioids and alcohol in the brain entirely, making it harder to experience a high and helping prevent relapse. Disulfiram, known as Antabuse, is used for alcohol use disorder. It creates an unpleasant physical reaction, nausea, vomiting, flushing, when alcohol is consumed, which discourages drinking. Acamprosate helps restore chemical balance in the brain after long-term alcohol use and is particularly helpful for managing insomnia, anxiety, and restlessness during recovery. Clonidine is used during detox to ease physical symptoms like agitation, high blood pressure, and sweating, particularly during opioid and alcohol withdrawal. And for stimulant dependence, medications like modafinil and bupropion are being explored, though this area of MAT is still developing. A common concern people have about MAT is this: am I just replacing one addiction with another? The answer is no. MAT stabilizes brain chemistry, blocks the rewarding effects of drugs and alcohol, and manages withdrawal. It's similar to how insulin manages diabetes. It corrects a physiological imbalance so you can focus on long-term behavioral change. The benefits are clear. MAT reduces the risk of overdose and death. It minimizes withdrawal symptoms. It improves treatment retention and outcomes. And it supports long-term recovery and daily functioning. As for cost, the Affordable Care Act requires all major insurance providers to offer coverage for substance use disorder treatment. So some or all of your MAT may already be covered by your plan. If you're ready to take the first step toward recovery, call 800-671-4304 right now. Specialists are available to help you find a licensed medication-assisted detox program near you. Help is one call away.